Okay. Good morning, councillors, officers, guests, members of the public and press. This is the September the 7th meeting of the Health and Wellbeing Board. Obviously, it is a virtual meeting and this will be recorded to go online. The usual processes will apply, but I'll just pass you over to Amanda to go through the roll call.
Thank you, Chair. Can I start with Councillor Buchan, please?
Yes, I've got the papers I can see in here.
Thank you. Councillor Moore?
Yes, I have the paperwork and yeah.
I think we've got Councillor Harrison for Councillor Thomas.
Yes, and I've got the papers. Thank you.
Thank you. Councillor Ward? Is Councillor Ward with us? Okay, I think there might be apologies for Councillor Ward. Dr. Timlin?
Yeah, but I've got the papers, thanks.
Thank you. Thank you. I've got David Gallagher, but I believe Martin Short might be substituting for David. Is that correct?
Yeah, that's right. I've got the papers as well.
Thank you. Craig Blunderwood?
Yes, yeah. I have the papers. Yeah, sorry, I was off mute there.
Sally Robinson?
Yeah, present and correct, Amanda.
Thank you. Jill Harrison?
Yes, also present and correct, Amanda.
Thank you. Margaret Wren, I think we've substituted by Christopher Akers-Belcher.
Yes, present. I have the papers also.
Thank you. Denise McGuckin?
Yep, present and have the papers.
Tony Hanson?
Yes, Amanda.
Thank you. Danielle Swainston?
Yes, Amanda.
Thank you. Dr. Tim Butler? I'm not sure we've got Dr. Butler with us, no. Tracy Woodall, I believe Nicola Hagan is attending as substitute for Tracy. Is that correct? I'll come back to Nicola. Dominic Gardner? I think Dominic's just joining us. Peter Graham, I understand, is substituting for Superintendent Sharon Cooney. Well, that was the plan. Fiona Adamson.
Hi, Amanda. Morning, everyone. I'm present and correct, can see in here.
Thank you very much. And Hilton Heslop, I understand, is representing the North Tees and Hartlepool NHS Trust. Has Hilton joined us?
Yes, he has, but he had you on mute there for a second.
Oh,
yes,
right,
thanks,
okay.
Sandra. I'm here and I've got the papers, thank you.
Okay. Is there anybody else with us that I haven't called out in the roll call?
Yeah, Edward Jeffries from Unison. Thank you.
Thank you, Edwin. Okay, that concludes the roll call then. Thank you.
Thank you, Amanda. Apologies for absence. I did receive apologies from Councillor Ward earlier today. Have we received any others? Other than the ones that have already been mentioned? No. Okay, thank you. We've got two sets of minutes to have a look at this morning. There are the minutes from the meeting held on the 26th of June, and then also the minutes of the Outbreak Control Engagement Board, which was held on the 27th of July. Are there any questions or comments on those minutes, or are we happy to sign them off as okay? Okay, I don't see any dissent from that, so we'll take those minutes as read. Thank you. Moving on to the items for consideration then. Sorry, can you just mute? I'll mute them. Okay, so we'll move on to item 4.1. That's the Tees-wide Safeguarding Adult Board's annual report for 18 and 19. That's Jill Harrison and Anne Baxter, I believe.
Good morning, councillors. Good morning, colleagues. Shall I start off? Really pleased to be with you in these strange circumstances. My name's Anne Baxter. I'm the independent chair of the Tees Safeguarding Adult Board. Each year we are statutorily required to produce an annual report, and it is important that I present that report to you as a health and wellbeing board, because as two strategic partnership boards that focus on health and wellbeing and the safety of our most vulnerable adults, I think it is important that we share information and look to where we can work together more closely to ensure that we have the impact we want to. By the nature of annual reports and calendars and then COVID, the report on your agenda today is really out of date. I mean, it goes back to the period in April 2018 to March 2019. So it's well over 18 months out of date. And we are working on our current report, which I had hoped we'd be able to bring to you, but not quite. So if I refer to the annual report in your agenda, but try and bring it up to date, the Safeguarding Board is a statutory board that we established across the 4 local authorities in Tees in 2015 after the Care Act, with our key partners in health, police and the voluntary sector. And the purpose of the annual report is to summarise the work undertaken in that year and to look at what the priorities are of activity going forward. The structure of the board set out in the report, detailing the engine room, which is the 6 subgroups of the board, and the task and finish groups that did work on particular issues throughout the year. Importantly, we need to reflect on the data, and we are getting better at collecting data across the partners, that's the local authorities and health and police particularly. And we're seeing that there is an increase in concerns being raised to partners about safeguarding adults, which we feel is positive, that people are increasingly aware of the importance of safeguarding adults and know what to do. So concerns come in, and those concerns are then, some of them then move into a safeguarding inquiry where there's a sufficient concern that there needs to be an investigation. So over the 2 years that we're talking about, we've seen an increase in concerns and an increase of those concerns then going into inquiries where colleagues actually look at the individual and what's happened. And currently we're at 56% of our concerns that are raised that lead into an inquiry, which we see as positive. I think the national average is 35%. So we interpret that we're getting the right information out to colleagues in the community, that they know what to do when they're worried about a person, and that they are then directed into the appropriate channels so that action can be taken. When those concerns are investigated, we're seeing that nearly 50% of them are safeguarding issues of people in their own homes. Again, this is positive. Over the last few years, we've seen an increase in concerns in people's own homes. In 2015, when we started collecting the data, most of the concerns were coming from care homes, because care homes really had the processes in place to send in the concerns. But most of our communities live in their own homes. So that's positive progress. And we're seeing over 50% of the safeguarding concerns are around neglect and acts of omission. Still, the numbers of concerns around self-neglect and modern slavery and exploitation are low, but they are gradually increasing, which again suggests that we are raising awareness and increasing people's vigilance around these concerns. The report sets out the priorities and the key achievements and challenges in the year, and again bringing those more up to date. We were saying that our priorities in this report were to improve awareness of safeguarding. So within the last year, that has continued despite COVID. We did have, we participated in a national awareness scheme back in November. In October, we had a major event with our colleagues in the Police and Crime Commissioner's Office and Anti-Slavery Network around exploitation. We've developed safeguarding champions out in the community, and we currently have 182 of those. So we are making progress at raising awareness. In training, we've seen that training around safeguarding has continued, particularly the ability of colleagues to perhaps take on the e-learning packages over these last 3 months. So within the last year, over 3,000 professionals accessed e-learning, and about 300 accessed face-to-face training. Two priorities for the board are to look at the quality of the services, and we do that by a range of policies, guidance, training and audits. And we have a multi-audit system that has progressed well over the last 2 years, where we ask each of our key partners to audit their safeguarding practice, and we're seeing that that's the learning from that is continuing. And then a statutory duty of the board is to consider serious adult reviews when someone has sadly either died or there's been some serious injury to them because of the way that the organisations are working together. So in the 18 to 19 year report, we saw 6 referrals, which led to 1 serious adult review. And more recently, in the last year, we've had 9 referrals. Your own director, Jill Harrison, chairs our serious adult review subgroup and is kept very busy doing that. Of the serious adult review from last year, Josh, that was a case that was a young man who sadly died. He was a young man who had diabetes and a range of multiple vulnerabilities, including homelessness and alcohol and drug misuse. And we are seeing that it is those very high risk individuals who are particularly at risk of death across the country. When we look at the pattern of serious adult reviews across the country, it generally has been in the last years people between about 20 and 50 who have that whole range of challenges and problems. As a result of adult reviews, we are trying to learn and improve our processes. And one of the initiatives that began in Hartlepool now a couple of years ago, the team around the individual, where when high risk people are identified, colleagues get together across all the organisations, including community and housing, and together formulate a package of care and identify a key person to work with that individual. And I'm pleased to say that that really is working well in Hartlepool and is one of your strengths. We don't have any serious adult reviews at the moment, but 2 learning lessons reviews which are ongoing, and again do highlight it is these highly vulnerable, high risk individuals that take up a lot of concerns. So it's been a very positive year in that despite COVID, we have seen an ongoing rise in activity around safeguarding, and we've seen colleagues across the organisations working together really well, using technology like this, and we're all getting much better at it, aren't we? So communication has increased, and the reports I'm getting is that quick and responsive action when there are concerns and colleagues working together much better. I think we share with the Health and Wellbeing Board particularly priorities around domestic abuse and concerns around the results of drug and alcohol abuse, also modern slavery and exploitation. So going forward, I think one of our priorities continues to be working more closely across these strategic partnerships so that we're doing things only once, we're sharing information, we're sharing data, and colleagues on the ground are working together operationally as positively as possible. So I'll pause there and hand over to Jill, and perhaps she could bring you up to date with particular Hartlepool issues. Thank you.
Thank you, Anne. That was a really helpful summary. I suppose just to make the board aware, as Anne's highlighted, there will be a further annual report coming to you very soon because of the time delay in the previous report. Obviously unavoidable due to the current circumstances. From a Hartlepool perspective, I'd say there's lots of the Hartlepool partners very well engaged in the work of the board and the subgroups. The board's working very well at the moment, despite some of the challenges, I think. And we haven't seen any particular issues locally in Hartlepool that we'd need to flag with the board. I suppose just to emphasise the point Anne made about the importance of joint working with the other partnerships, we are seeing very much some common themes in safeguard and adult reviews that are very similar to those in domestic homicide reviews, and again some similarities with themes that are being seen nationally in serious case reviews from a children's perspective. So certainly some areas where there's opportunities for us to work more closely across the strategic partnerships, and I think that's something that we'll be looking to promote in the coming months, really. Happy to take any questions that any of the board members have.
Thank you very much, ladies, for that really comprehensive update. I've got Nick Timlin.
Hi, yeah, I'd just like to say it was a really good report and very easy to read, and I loved the little ditties about the patients, the real sort of life examples. I thought was great. There's one thing I wanted to be interested in was in Hartlepool has a lot of Teesside safe place schemes. I mean, and it's certainly from population point of view is much better than the rest of sort of Cleveland. And I was just wondering, what's that made up of? Is the sort of domestic abuse houses? I know it mentions sort of like police, fire brigade place. I'm not sure how that works. You know, as Midland have got because they've got more people, or have they got have they got like bigger places, or has Hartlepool just got a lot more involvement?
Shall I go first and then Jill? Yes, yeah. Per capita, Hartlepool is ahead across Tees. And I understand that you've had 25 new places open recently over the last year. And these are a range of schools, shops and community places where anyone can go who needs to be. Perhaps I'll hand over to Jill with the details.
Yeah, it's something that we've had in place in Hartlepool for a long time. It was originally put in place particularly around supporting adults with learning disabilities who might find themselves in trouble, you know, sort of concerned, not able to find, for example, how to get home, might get lost, might get confused. So we did a lot of work a number of years ago with lots of the shops and businesses in the town centre. And basically it means that the staff members in those buildings, in those premises, have been trained in how to support somebody who might come to them, who might be confused or who might need some help. So, as I said, it was originally an initiative around adults with learning disabilities, but it's equally relevant now for example, people with dementia or somebody who might just feel vulnerable, might feel threatened. And so it's somewhere that they know they can go. So the shops display a sign that says they're a safe place, and people are aware that that's somewhere they can go if they need help. And lots of people have sort of a contact card as well, so that a trusted relative or family member or friend can be contacted if they're having any difficulties. So it's something that we've just done an audit of as well and checked that, you know, all of those places are still on board with the scheme and that staff are trained and up to date. So yeah, it's a really positive development, and I think it was originally started in Hartlepool and then it's rolled out to other local authority areas over the last few years.
Thank you. Did that answer everything you wanted, Nick?
Thanks. Well, I was just going to point out, I've been reading a few papers on adverse childhood experiences becoming sort of physical illness in years to come. And certainly, I think sort of putting money into domestic abuse areas is a good idea for sort of future health of the population.
I don't think there's many people who would disagree with you on that one, to be fair, and it is one of our priorities moving forward. I've got Councillor Harris.
Thanks, Chair. Yes, I'd like to echo what's already been said about the report. I think it was clear, it was good reading, and the anecdotal ideas were very good. It gave you a better insight, I think, into what's going on. I just wondered, in the present COVID situation, and I do understand that the report may not be completely up to date because of the situation, so you may be already addressing this, but it would be good referrals during this period. I think that would be helpful, and what exactly is being done to ensure any issues, which Jill said there weren't any in Hartlepool, but are there issues that we don't know about because of the present situation, and what's being done to pick up on those, despite the restricted visiting in care homes and hospitals, for example. And I do have another question when that's been answered, if that's okay, Chair.
Yeah, that's fine. Can I just confirm though, Brenda, you broke up a little bit for me. I don't know if it was the same for everybody else. So we missed the part just before referrals. So I think that might have been the actual key point of your question.
So what's actually being done to ensure the issues that are still being picked up despite the restricted visiting in care homes and hospitals? And I did say that further information on referrals during this period would be helpful.
Thank you.
Is that okay?
Jill,
Yep.
Can you answer that one?
Yeah, so from an operational perspective, we still have our usual safeguarding arrangements in place. Obviously, we're having to respond to those differently. So rather than face-to-face meetings, there are lots of safeguarding meetings taking place in a similar format to this. But the usual way that people can raise concerns and that those concerns are investigated, all of those arrangements are still in place. We haven't seen a particular increase in alerts over the sort of COVID period, but we haven't seen a particular decrease. So actually what we're seeing is a similar level of activity. We're just responding to it differently. The one area where we were concerned that there may be a particular spike in activity was around domestic abuse. Obviously, there's been information in the national press, and that does seem to have been a feature in lots of other areas, but it hasn't been a particular feature in the Tees area. I know that was raised on a call. Sorry, I was on leave last week, but the week prior to that, it was raised on a call where Cleveland Police did highlight that was unusual, that we'd actually seen a decrease in domestic violence alerts in that time. So that might be something that we need to look at. But in terms of current concerns, we've still encouraged all partners to raise concerns in the same way, and we're still responding to those in the same way. But obviously we do quarterly monitoring of all the data, and we do have a Tees Safeguarding Adults Board coming up shortly. So we will be looking at the data that will cover the COVID period. So it will be interesting to see if there are any particular trends or issues that we need to follow up on from that.
Thanks, Jill.
Yeah.
And
Okay, can I just come in from the board? Yeah, from a board's perspective, I think one of the advantages of the structure is that we can collect data from a wider group of partners, and that good data helps us ask the right questions. Compared to other places, we have seen that regionally and nationally there was a drop in referrals, and as Jill said, we haven't seen that in Tees, which I think is good. Yeah. But we are monitoring whether there'll be a rise as people return to some of their activities. I am hearing from North Tees, for example, that there's been a rise in presentations at A&E and concerns about alcohol and drugs. So again, they may be people who didn't ask for help over the last few months and are coming forward. As Jill said, we've got a meeting of the whole board in just a couple of weeks. So we will be talking about the COVID period. And we will be reflecting that learning when we bring you to the next report to this board.
Thank you. And is it okay if I just ask another question, Chair?
Yeah, sure.
Thanks for that. That's been very helpful. And I just wondered if the board will be challenging the government's reaction to safeguarding or lack of reaction to safeguarding back in March and April time, when people were discharged from hospital into care homes without being tested, resulting in thousands of avoidable deaths across the country and particularly locally. I wondered if there was going to be any response from us as a, from you as a board, to that particular issue.
Thank you, Councillor. We're not planning any direct response from the board, but the information that we gather feeds into, for example, the National Association of Directors of Adult Services, and I'm a member of the National Independent Chairs Group. So we gather all that information and feed it into the national groups, and also the Local Government Association. So we are feeding into those organisations that are sitting round the table with colleagues from the department and raising concerns, but not particularly from the Tees board.
Right. Thank you very much.
Thank you. And I've got Dominic Gardner.
Thanks, Chair. So Councillor Harrison's picked up on a couple of the points I was interested in, but I was also just as a kind of supplementary in terms of reporting, just looking at the categories that safeguarding can be recorded under. I'm just thinking there's a number of categories where you could see there potentially is an overlap. So in terms of domestic and exploitation, in terms of financial issues, physical, etc. And I'm just wondering, in terms of that sense check of the data, is there anything that's done within the kind of, is that described by the person who's making the referral, or is that coding done by a practitioner who's more experienced in those categorisations?
If I pick that up first, then Jill, it's picked up by the professionals who are linked into the processes, and as you say, often how it's viewed could be quite subjective. You know, for example, an elderly person living with her adult child who may be taking money from her to fund a drug habit and sometimes being violent. You know, that could be domestic abuse, it could be financial abuse, it could be physical abuse. So we're very aware that categories can overlap, and we're trying to work towards a consistent way of looking at these issues across Tees. So I'll hand over to Jill from the Hartlepool perspective.
Yep, so as Anne said, from an operational perspective, the coding's done by the safeguarding team, so the specialist safeguarding workers. There are national definitions of the categories, and what tends to happen is that what's deemed to be the main cause of the referral is how the referral's coded, but it is recognised that, as Anne said, there's overlap and there can be multiple issues. I think what we had in the past was lots of cases were recorded as multiple potential abuse in a single circumstance, and actually that wasn't helpful because it just meant we had an awful lot of cases counted, classed as multiple abuse. So the operational leads from all of the organisations meet on a regular basis, and also our data leads meet on a regular basis. So we do think that we've got a much more consistent approach now, but we do continue to work on that to try and make sure that the data's as useful as possible.
Thank you.
Okay, thank you very much, everybody. There's nobody else with any questions or comments, or if you do, can you let it be known now? Great, thank you. Okay, if we look at the recommendations then, the board is being asked to note and then endorse the report for 18 and 19 and the strategic business plan for 2021. Everybody okay with that? Great, thank you very much.
Thank you very much, everybody. Nice to see you. Thanks a lot.
So we move on to 4.2. That's the Better Care Fund with Jill Harrison.
Thank you, Chair. This is the regular quarterly update regarding the Better Care Fund that board members will be very familiar with. So I won't go through the background in a lot of detail. This report covers the period January to March of this year. So it is the year-end position for 2019-20. And the detail regarding performance is contained in section 3. Just wanted to highlight really that there have been some changes to the data collection linked to COVID. So some of the data collection was suspended towards the end of the year. But regardless of that, the position for Hartlepool is incredibly positive. We were on track to achieve all of the indicators at the year end based on data, and this is the first year since Better Care Fund was introduced that we've been in that position. So it was really just to highlight that there's been some excellent work undertaken over the year by partners, predominantly the council and the NHS trusts, but also very good joint working with our providers such as care homes and home care providers that have enabled us to achieve that performance. So a positive year and lots to build on. Obviously, we're not entirely sure as yet what performance will be like in the current financial year. There have been delays in terms of data collections being required. But last year we had very challenging targets, so it's really positive to see that those have been achieved, and thank you to everyone who's contributed to that. Happy to take any questions, Chair.
Thank you, Jill. Can I just say there are some really, as you said, some really positive things to come out of this report, and so much so that I think it's the first time that this agenda item has received positive news coverage in the run-up to the board meeting. So it is really positive to read this time around. Are there any other questions or comments from members? None? Okay then. Well, the recommendations are that we retrospectively approve the Q4 return and that we note the position in relation to performance, which is extremely positive. Any dissent from that? Great, thank you very much. Agenda item 4.3, that's the Health and Wellbeing Board Terms of Reference refresh. That will be Craig Blundred.
Okay, just trying to get myself off mute. I think this is, where are we? Trying to find the papers. This is where we refresh the terms of reference for the board, including the local outbreak engagement working group terms of reference as well, which we've included in there. We've had those out to consultation and they have now been completed and finalised, which is attached in your notes, with your notes there. I think really this is just to approve that, those updates to the board papers.
Thank you, Craig. I'm happy with the change in the terms of reference. Obviously, we know why we're here. We spoke about this last time round. Are there any questions or comments from any board members? Councillor Harrison.
Thanks, Chair. This actually has come from Stephen, so I'll try to do his bit of justice. He says that point 7 of the terms of reference, which is engaging with stakeholders, will it reflect, and in line with the findings of the recently published NHS reset paper, a new relationship between the NHS people, the NHS people and communities learning from COVID-19? He points out that there should be real engagement and inclusion, which is vital going forward. I don't know whether you can answer that, Craig, at the moment.
I can't answer that at the moment. I mean, obviously, a key part of the COVID response as well is the engagement strategy that we're looking at preparing and working on with the engagement group. So, yes, we will be focusing on further engagement with all key partners and stakeholders as part of that. I'll go away and have a look at that and can bring back some further information about that at this time.
Okay, is that all right?
Yes, thank you.
Yeah.
Yes, sorry. I'm
Sorry.
having trouble as well, Craig, with my mute. There's also something in 8.10 talking about the subgroups. I think basically Stephen is trying to ensure that that there is representation from the Tees Esk Weir Valley Mental Health Foundation Trust as core members. Mental health of fundamental importance, obviously, going forward. So he wanted me to make that point.
I think, yeah, as a key partner, we would always engage with them in terms of any work that we were doing. So yes, yeah, that would be noted. But yeah, we would always do that.
And Dominic, you're one too.
Sorry, so obviously we're a core member of the board, and we should also be replicated in subgroups sitting underneath that. So I think if there's been any particular issues in terms of representation at any particular group, then I'd be happy to pick that up. But absolutely the sentiment around the importance of mental health, I absolutely agree with. And it's something I was going to bring up under any other business, but I think it segues into this quite nicely now. One of the things we've just done at the South Tees Health and Wellbeing Board is to present a forecast which is describing some of the potential impacts of COVID upon mental health for people within the Tees geographical locality. And one of the things I'd be keen to do would be to offer that, to provide that presentation here. But one of the things that I did very specifically was engage with public health and with the DASs and the DCSs, just so that we could give it a sense of what the overall system response would look like. So I suppose it's an offer to do that, and then also I suppose a request of colleagues who are part of this board to engage within that and support that as well.
Thank you. Thanks, Chair.
I think that would probably be a helpful presentation to have, to be honest, Dominic, and I'm sure we can organise that. The next meeting isn't until December, isn't it? But I'm sure we can either try and put something in before for a subgroup, or I'll bring it to the December meeting, if that'd be all right with you and other members.
That would be great for me, thank you.
Greg, will you want to come back in?
Yeah, thanks, Chair. And just to say and reiterate that as a key part of the recovery planning that we have for COVID, that mental health is a key issue that we will include within all of that, and is a key focus for a lot of our work. So to reiterate that will be ongoing as well.
Thank you. Are there any other questions or comments? Okay, then the recommendation, I just need members to approve the refreshed terms of reference. Are there any issues or any dissent? Okay, thank you very much. Agenda item 4.4, coronavirus in Hartlepool, an update from Craig Blundred.
Thanks, Chair. I think this is where we just see if the technology works with the presentation, so I'll just wait for the presentation to be loaded up. So just while we're setting that up, what I'm going to talk to you about is the current position we have at the moment, and also look back on the course of of COVID-19 across Hartlepool over the period from March this year. And what we'll do is we'll look at the incident rates and various other aspects of that. Thanks, Joan. So what we've got here on the first slide shows us over time the COVID cases rate. And I think one thing that's striking is that Hartlepool has seen a higher rate of cases than we have actually seen across the rest of England. And I think that has continued to this day. I think for pulling up the current rate of cases, we're currently at 736.7 per 100,000 people. Which again is quite higher than the England average, and I think there's a number of reasons for that. Potentially things like deprivation, and existing poor health has contributed to the case rate as we have it at the moment. It's obviously a concern for us. So, you know, we haven't been able to reduce it at this point. So it is always something we're monitoring at the moment. The next slide, please. If we look at the progression of the disease across time, this slide shows the number of weekly cases by week. And you can see there that Hartlepool lagged a little bit behind the England number of cases, but it's in a similar pattern. We saw the peak, obviously, around April, May, and then lockdown occurred and we saw the cases tailing off. What's interesting to point out at the moment is now we're actually starting to see an increase in the number of cases. And I think one of the things that's a bit of concern is towards the end of this graph is that over the last few days and week or so, we've now started to see quite a large increase in the number of cases in the area. And particularly the northeast has seen that, but we're starting to see a larger increase in the number of cases within Hartlepool. And that's now a concern for us. I think in the last week or so, we've seen around about 30 to 33 cases identified. And we were looking at really generally an average of about 9 or 10 for the few weeks before that. So it does suggest that we are starting to see the disease sort of coming back in a bit more aggressive way. Slide, please. So the cases rolling averages up to the 6th of September. You can see again that reflects the peak in April to May. But again, at the right of the graph there, you can see for Hartlepool, it's a bit of an uptick there on the 7-day rolling average, and that's not reflected across the whole of England. So again, it's looking likely that there is some localised increases occurring in Hartlepool. What's also interesting is when we look at the data and the information behind that, what we're seeing in the more recent cases is that we're starting to see more cases occurring in younger people, so the 18 to 35 age group particularly. And again, there's a number of theories why that might be, but it is particularly concerning that we're starting to see them in that younger age group. Next slide, please. That also reflects on some of the wider data and some of the arguments you'll see around about what's actually happening. And I'm sure you'll have seen a lot of media reports about, you know, suggestions that the cases aren't as bad or anything like that, because we're not seeing, for example, increases in the death rate. This is a graph showing the death rate over time, again, over the course of the pandemic, which again shows that Hartlepool has had a higher death rate per 100,000 than England. And again, there's reasons linked to sort of pre-existing health conditions and deprivation and all of those things. What we haven't seen at the moment recently is an increase in the number of deaths as the total deaths per week have declined. And again, people will often point to that and say that, you know, are there changes happening with the virus or anything like that? It goes back to my point that we raised before, that actually we're seeing more infections in younger people, and what that means is then that they won't have that pre-existing condition, and it doesn't have as much of an impact as it may with older people, which is one of the reasons why we're not seeing as many hospitalizations or deaths at this point in time. One of the key things, though, I would reiterate is, though, that this is potentially the start of another increase in the number of cases, and that if we look to other countries abroad, and particularly in the United States and Europe, what we've seen is that the younger people will start to have the cases, and then that will then spread to older people as well, with the subsequent potential for increases in hospitalizations and mortality rates. Next slide, please. So this is the final slide, just to give an indication of where we've been seeing cases from the start, again, of the pandemic. And basically what this shows is what we would generally expect is that the main areas of population have been those areas that have been most affected. And also, again, that we're doing some work to look at those links with the more deprived areas and work out, you know, how they've been affected as well. And what you've also see on there are some of the care homes illustrated, where we know that there have been hotspots in the past in terms of those COVID cases. I think one of the things what we need to think about now is we have seen this increase in the number of cases, and it is a concern for us. And one of the things we need to be constantly reiterating is the need to maintain that social distancing, and also for people to maintain their awareness of what the symptoms are. of COVID-19, so that when they do get symptoms, they self-isolate, and to test straight away and not to delay that. It's also to reiterate that we will be putting messages out again to the population to reinforce that they shouldn't be attending work if they're symptomatic, or they shouldn't be doing anything really, leaving the home and getting tested. That's one of the key drivers, I think, of cases starting to spread. We think is that people are being more sociable and are returning to work, and it's something we're likely to see increasing if we don't do something to reinforce those messages about people staying at home if they have symptoms, getting tested, and isolating as well. And particularly people who also live with them should self-isolate as well for the recommended periods. We will be increasing that messaging as we go ahead. We're also looking to increase the amount of testing that's available within the town. I have a meeting later on today to look at how we can increase that given the number of cases. What we have found with the recent data is that we have a higher positivity rate than we would normally expect, and what that means is that when you have a number of cases, a number of tests carried out rather, the proportion of positive cases often rises when you increase the number of tests. What we're seeing in Hartlepool is that the tests have reduced slightly, but the number of positive cases has increased, and that is a concern because that would suggest that there's a higher rate of infection within the town. So we are looking at to see how we can increase the amount of testing that's available to our residents this week. So we aren't out of the woods by any means, and it is looking likely that we're starting to see an increase in the number of infections across the town. So again, we need to be reiterating those messages about social distancing, social isolation, getting tested. And also we are keeping an eye on the data very closely to try and spot any clusters, any outbreaks that also might be occurring, because that's another issue we are working with our colleagues in Public Health England to address as well. So it's unfortunately not brilliant news that I bring you from the data that we're seeing at the moment, but obviously we do need to be aware of that so that we continue to be vigilant and put in place actions to mitigate any risks. So I'm happy to take any questions about that.
Thank you, Craig. No questions from me. I think I know I've shared this previously at CMT and others. I personally don't like the measure of the per 100,000. I think it and I appreciate it's a national measure, but I think in smaller towns like Hartlepool, it doesn't necessarily give a good picture, or rather it sends a mixed message when we're constantly telling our residents how well they've actually done throughout this compared to other areas. I think it causes that little bit of confusion. I appreciate, as I say, it's a national measure, and we do need to keep an eye on the cases, but it's just my personal preference. I don't like that measure, if I'm being honest. I've got Councillor Harrison to come in.
Thanks, Chair. Yeah, I share your views, actually, Shane, about that, and I think sometimes it sort of gives a bit of a skew with kind of picture. However, it is worrying and it is a concern, and I think we need to address it very, very robustly. Can I just ask, Craig, before I go on, from that map there, am I right in thinking that in Hart and Dalton, Piercy and Elwick, there have been no cases?
I think
or have they just not been put on the map?
There have been cases. I think it's a heat map. It shows the concentration of cases. So,
right.
Yeah,
right.
The lighter the colour on the map.
So we're not all going to move to Hart?
I wouldn't recommend it. I mean, I think obviously it reflects population density as well.
Okay.
In terms of the higher number of cases.
So I'm just going to tell you, but yesterday I'd gone for a walk, with a socially distanced walk with one of my daughters, along Seaton Front. It was all very nice. Everyone was behaving themselves very well, and we bumped into someone we both knew, a father of ex-pupils, an educated man, someone who you would think would have a lot of common sense. And it's worried me a lot as to his reaction to the wearing of face masks. He doesn't think it's going to help, and therefore he's not wearing them. So he goes into a shop and is asked if he's going to, could you wear a mask? Well, I don't carry one with me. So, and I just was appalled. I had to bite all my tongues and everything, because it wasn't the place to have an argument. But it was really, I think, reflective of, I think, some people's attitude, because I think there's a lot of "I'm all right, Jack," and it doesn't matter about the rest. And it's interesting, Craig, that you've said that some of the cases have come in the younger people, but they don't then realise, or a lot of people don't realise, that then the older people and those with vulnerabilities, will be affected by this. It's very much, I know the message has gone out, and I know that there's been some very good messages gone out, but we really need, I think, to be a little bit more enforcing of some of the things that we think will help. I think face coverings will help. It might not be the solution completely, but it's one of the things that will help. And that when I wear a face mask, I'm not so much thinking about myself, I'm thinking about other people. And that's where I think it's all gone wrong, because people are not thinking about other people. And this meeting yesterday, it was just, I was gobsmacked. And if somebody of that sort of supposed intelligence, and thoughtful human being, thinks along those lines, well, I give up. So I think we should be a little bit more robust in our enforcement of some of the things. I don't know whether we can be.
I think that is a challenge about enforcing things. I think one of the key things we can also do, though, is work with our communities, particularly through our engagement board, to work with them to sort of, I think, possibly address this with the fact that we're all in it together, and that if we help each other, then there'll be a positive outcome for this. And I think that's one of the key areas I want to explore in the next few weeks, is how we develop that sort of community cohesion approach to reinforcing the messages, but also, as I say, bringing the town along with us. And hopefully that might negate some of these views that people have around not complying with some of the requirements of wearing a face mask or socially distancing. I mean, I share your concerns. I mean, I think certainly from I was out and about at the weekend, and people often weren't socially distancing, and I think it's something we need to keep reiterating with the messaging we put out. But also, I think we do need to do some more engagement work with our communities to support that messaging going out, but also how people comply with it as well.
Okay, thank you. Dr. Timlin?
Hiya, thanks, Chair. I'd just like to say that a lot of my patients, certainly the elderly ones, have been sensible and still isolating. And I think the reason why we've maybe not seen so many deaths in recent times is because they're looking after themselves and keeping away. And you're right, I think the spread and the increase in positive tests is due to mixing of the younger people who sort of, don't tend to succumb. I agree with Brenda that, we should still be pushing the sort of masks, and certainly I always wear mine, and push that message out. And hopefully we'll get through this, without too many sort of more deaths. We'll have to see how it goes.
Thank you. And Fiona Adamson.
Thank you, Chair. I just thought that members might be interested in what support's available in the background health-wise for those people who are diagnosed as positive or who are symptomatic. We took the decision in the early days across primary care that it would be best to have what we call hot sites, so our COVID care clinics, so that practices like Nick's could get on with treating the usual everyday things that were storing up in the background. I think the first thing is just to let you know that that hot clinic that's located at the front of the One Life in Hartlepool, sort of by the side of the car park where the minor injuries used to be, that's commissioned up until the end of March, as at this moment in time. And it's 10 to 5 and it's Monday to Friday. So there are doctors and nurses in there every day who are becoming quite experienced in helping people who've been diagnosed or who have symptoms. And then secondly, we are part of an NHS pilot. There are only 3 sites nationally. And that pilot is something called a virtual ward, although that's a horrible terminology. And the virtual ward is basically the ability for our people who are ill with something that seems to be COVID or who've been diagnosed. We will deliver to them some kit. So basically it's pulse oximetry, so the things that you put on the end of your finger. Every household gets one of those to keep for 14 days, and there's an app that helps them to track how they're doing so that we can monitor remotely the level of oxygen in the blood. And Nick would be much better than me at explaining this, but that's one of the key features when people start to go downhill, is to catch that really early. So it's something that people in Hartlepool have access to that other people nationally don't, and that's monitored by the GPs and the nurses in the hot clinics. So it's really important that we find a way, and data sharing is an issue, and Craig will be aware of this, to get as many people onto that virtual ward as possible, because the support is there. It's just very difficult finding out who the actual positive people are and making sure they've had the offer of the remote support. So that's the second thing. And then thirdly, as of Monday next week, again, we have an NHS England pilot, which means that anyone who's booked into our hot clinic, if the local GPs or nurses think that someone needs to look at them face to face and give them a good review, they can actually be tested on site in the hot clinic. Now, I would absolutely say that's not to replace the testing that Craig was referring to earlier, but it does mean that someone who is ill and who goes to see a GP doesn't then have to go somewhere else or book themselves another appointment just in order to get a test. So I just thought that members might be interested to know what's out there to support the local Hartlepool people.
Thank you for sharing that, Fiona. That was news to me, actually. I wasn't aware of those services, so that's really that's a really important update, and I'm sure we'll be able to help in advertising those as well. All right.
Great,
is
thanks.
there anybody? Sorry, is there anybody else who would like to speak or ask any questions? Okay. Just asking you to note that report then. Thank you very much, Craig, and for your assistance as well, Joan. Moving on to 4.5, we have the former Hartlepool and Stockton-on-Tees Clinical Commissioning Group Annual Report for 1920. Martin, are you going to be doing this one?
Yeah, I'll do that. Thank you, Chair.
Thank you.
First time I've been to the meeting, so for those that I've not met before, I'm Martin Short. I'm Head of Performance and Provider Management with Tees Valley CCG. The overview that we've got today is a summary of our annual report. So every year, CCGs are required to publish an annual report on their accounts. The report's normally made up of 3 elements: a performance report, an accountability report, and then the actual accounts. So some of the highlights of the report, I'll just move through. First off is the appointment of our new Chief Officer, Dave Gallagher. He started at the 1st of March, ahead of the formal merger, which then went on to be completed on 1st of April. The financial position, very challenging year financially. However, robust management throughout the year meant that our financial control total was achieved. So a really positive result there. Obviously, there was national struggles financially. So it's really positive that the CCG maintained that position. Onto the performance. So our main challenges within performance were referral to treatment and then diagnostics. So referral to treatment, the main issue for Hartlepool and Stockton patients was actually at South Tees Trust rather than North Tees Trust, and it was in quite a high volume specialty within ophthalmology. So when you get that high volume specialty, that there's a number of people being treated longer than 18 weeks, that means it actually has quite a high impact on the overall position. Within diagnostics, it was a mixture of issues between North Tees and South Tees. So at South Tees, we did have some equipment issues, particularly around neurophysiology, and then there was also some staffing issues for ultrasound at North Tees and Hartlepool. Both of them issues are now resolved, but obviously performance continues to be a challenge whilst we're trying to meet the backlog from COVID. Cancer standards, we didn't achieve the 62-day standards for Hartlepool and Stockton patients. In the main, that's down to the complexity of our tertiary pathways. So between North Tees and South Tees Trust, if you take out patients in isolation, generally speaking, North Tees manage to meet the standard and South Tees do. However, it's where patients go between the two. Then on to some areas where just general updates. So there was engagement with the public, of course, on the merger. There's been a long-standing engagement about the rheumatology services, but also on a really successful piece of work around repeat prescribing. As I said, this has been really good, and it's reduced a lot of waste within supplying medicines. There's a big development last year was the establishment of the primary care networks. We're expecting that actually a lot of services will be delivered through networks going forward, and there's now the national DES, the Directed Enhanced Services. Next one was an update on some training that's been undertaken last year and some accreditation around LGBT. One of the practices that undertaken that training and then achieved a LGBT Champions Award was Seton Surgery, which is obviously within Hartlepool. Other big projects, one of the ones around the rollout of the FIT test. So this is currently being expanded as well, because it's really helpful in terms of triaging patients that require normally 2-week wait referrals. So all of our trusts have introduced that now ahead of referral. Other issues, care homes, which we've already spoken about, but there was a big piece of work there trying to engage with the care homes to provide more advice, and that's proved to be quite successful. A number of care homes feeding back that they're feeling a bit more comfortable in dealing with some common cases from the improved knowledge and the confidence that they've gained through that. Finish on a couple of positive points around mental health, that we were successful in securing some funding across Tees Valley and County Durham for crisis care. So that was £2 million across Tees Valley and County Durham. And within Tees Valley, it's meant that we've been able to provide a dedicated psychology resource within crisis services. Slightly different model in County Durham, but that's how we've dealt with it within Tees. And the second one is the Trailblazer bid that was part of a national ask from NHS England around the mild to moderate mental health needs for children and young people. So they're both really positive. So that's the summary of the report, and I'll take any questions.
Thank you, Martin. Are there any questions or comments from any members? No, it doesn't look like it. Right, thank you very much for that update, Martin. Obviously, that only brings us up to this current year, doesn't it? So we'll look forward, I guess, to seeing how services have been impacted this year with everything that's been going on as well.
Yeah, there's a big focus on recovery at the moment. I'm sure you'll have seen the national stories around providers trying to get back up to capacity of where they were previously, and then trying to reduce that backlog. So yeah, lots of effort in that area at the moment. Great,
thank you very much. So the board is being asked to note the content of the report, and if there's no dissent, I'll take that as okay. Okay, thank you very much. We have one other agenda item, the annual report from the Director of Public Health, and Craig, you'll be bringing this one. Yeah.
Yep, that's correct. And another bit of technology that I hope works to present this. As you'll be aware, the Director of Public Health has to produce an annual report. And over the past few years, they've looked at a variety of different elements of the health of the town and presented progress on activities on those. This year, we've gone for a very different and innovative approach to how we present the report. We've looked at a video or a compilation of videos which give you a real feel, I think, for the activities that we're carrying out, and also sort of showcase some of the work that's gone on in the past year, and also the communities we're working with to support this work. This year, we're focusing on obesity prevention and physical activity. Which again is one of the key issues for the town, and obviously that work, even though we're in the middle of the pandemic, it has taken on some more significant, because of that and the links between some poorer outcomes of COVID and sort of excess weight. But also, again, it's still a major health issue for the town in its own right. So what we've got, the link is in the paper to the report, but what we've got for the meeting today, I think, are two videos, one showing just the format of what we're doing and one illustrating one of the groups we've worked with. So I don't know if Joan can see if we can get the videos on the screen now.
No pressure. Sorry, just trying to sort the volume out.
I think just while we're waiting, it'd be useful as well, I think, for us, because it's a new way of delivering it, to get some feedback as well on this approach, because I think one of the things we've tried to do with this is to make it a lot more accessible for people, rather than just having a standard report that sits on the website. It is actually using this to increase the accessibility of it. Working with the residents of Hartlepool is a true partnership approach to helping them to achieve a healthy weight. There are many different activities going on across different departments in the council, and also working with partners to encourage people to achieve a healthier weight and to engage in physical activity to help them to do this. Examples of this include things like cycling and walking. Cycling and walking is really helpful as it helps people to build physical activity into their everyday lives. We have a number of different initiatives, such as the Bikeability Programme, cycle leader training, and the development of infrastructure, which helps people to do this. Looking at our parks and coastline, these are really important assets we have in the town, which also help people to maintain a healthier weight through increased physical activity. Good quality parks and open space encourages people to go out and walk and cycle, and that's really beneficial to their health. We've also been working with our planning department, who are looking at a supplementary planning document to restrict the number of takeaways within the town. This is really beneficial as it reduces the amount of high-calorie, high-fat foods that are available to people, and has been really successful in limiting the number of takeaways we have. We want to work with families as well, and have been doing a lot of work with our health visiting team to encourage new mothers to breastfeed. Breastfeeding is really important in terms of improving the health of the child, and it has a long-term effect on being able to reduce the incidence of overweight children as they grow older. Our leisure services offer is also providing opportunities for people to engage in activities that will link to healthier eating and physical activity, and that's based on their leisure centres and community-based programmes across the town. Finally, we're working with our NHS partners to look at service provision to help people who may have got excess weight to lose that in a structured way. Overall, this partnership working is helping us to help other people to maintain a healthier weight and to improve their health. I think the next one is junior funability, is it?
Yeah, we just have to give this a chance to load the next one.
Hi, I'm a level 2 coach at the Hartlepool Borough Council, and we run a weekly funability session on a Thursday, and it's basically aimed at children with a wide range of disabilities. It's from age 6 to 16, and basically it's just a session to have the children come along, try loads of different sports such as football, badminton, hockey. We have the sports hall area, so it's just great for the children to blow off some steam and get them running around, learn the fundamentals of sport, and also to keep them nice, healthy, fit, and keep them at a very healthy weight.
So those are just examples of a couple of the videos that we've got on there. There's several other videos which highlight different activities and different age groups across the work that we're doing within Hartlepool, but also as well some that give the background to some of the obesity problems that we're facing at the moment. So I'd recommend you have a look at the website. They're all on there, and probably easier to look at than looking at over Teams, I think. But that's just giving you a flavour of what we're doing at the moment. So I'm happy to answer any questions you might have about that, if anyone has any.
Sally?
Yeah, it's not a question, Craig, but I suppose it's just a comment on the format. I just wanted to say that I often, in previous years, public health reports become sort of a narrative that you know, sort of sits on the shelf as a brochure. And actually, I find the interactive method, you know, it's much more interesting and much more accessible, I think, by the way that it's formatted. So I know that you and the former DPH and also our comms team worked hard on that. And actually, I think it's really worked. It's just a view. Thank you.
Thanks, Sally.
Councillor Harrison?
Yeah, I would echo that, what Sally's just said, and just say that I think anything that engages people to find out information that is better than trolling through a lot of words. Sorry to be, but it is better. So yes, and I look forward to seeing the whole thing rather than it in bits. I know technology is a dreadful thing, but yeah, that's good, Craig. I think well done.
Thanks. Yeah, and I think it is just to reiterate that actually we were trying to make it more accessible and particularly more accessible to you know, not just specialists who would read it, but you know, the general population as well, because it is a report for the population of the town.
And Hilton Hesler.
Thanks, Chair. Craig, I think it's fantastic. Everybody has really echoed what I was going to say in terms of the different way of approaching an annual report like that. It's far more accessible. Probably not going to award any BAFTA nominations yet, for the performances, but I can see them coming. I can definitely see them coming. But certainly, I think with the input from the community and obviously from the staff, but also seeing the participants from the children and also the other members of the public involved, it brings it more to life rather than just a set of papers, a set of words, which we're all. We all publish and put in the public domain. So well done, really commendable. Well done.
Thanks for that. Yeah, I'll not tell you how many takes it took to get my bits done. So yeah.
Thanks, Craig. They probably didn't take as many takes as mine usually do, but yeah, I mean, I was surprised. I really liked the format, to be honest, and I had to look a little bit more closely at the video of the kids playing there because I thought it was my own son at one point. He lives in his pool strip at the moment, and it looked like him playing hockey. It wasn't, but yeah. But no, it was really good. Thank you. Was there anybody else who wanted to come in on that one? No. Okay. Well, like many of the others today, we're just being asked to note that report. So if everybody's happy, we'll mark that as noted. Thank you. And you can crack on with getting the next one ready now, Craig. Yeah. Right. Thank you very much. Then there is no other business from me. Was there anybody else who wanted to raise anything before the end of the meeting? Okay, thank you very much then. We'll see you all again on the 7th of December, if not before. Thank you. Have a lovely day.